So my name is Mike Weaver, and I'm going to sort of be the host of this meeting. And with me today is Alex Rainville, Jim Piper, Matt Dunning, and Ryan Sofel. These guys are going to help us walk through some of the basics of now that we've got sort of a lightening of the not stay in place here in Nebraska, but certainly the restrictions here in Nebraska. And some businesses are going to be starting to open slowly. What are some of the practical things from not just opening, but from an employee standpoint, customer standpoint? What are some of the things that you should be looking at? And we're going to go a little bit toward the end of the presentation over the PPP forgiveness, what you should be doing in anticipation of getting as much possible forgiven as you can. Now that a lot of businesses, and in fact, Nebraska did very well as far as businesses obtaining funds under the PPP program. Now that you've got the funds, what should you be doing to make sure that when it comes time to get the forgiveness, that you're getting the maximum amount that you can? So I'm going to go ahead and get started. Practical steps for safe and smart reopening. So Alex, we were talking a little bit about some of the things, not only from an employer standpoint, what you can, or from the employer standpoint, what you should be looking at for both your employees to keep them safe, and your clients and customers to keep them safe. So why don't you go ahead and start us off on that one?
Yeah, absolutely. Thanks, Mike. Yeah, the first step really with all of this is trying to evaluate your risk, because that's going to ultimately dictate what measures you take, what steps you take, what policies you decide to put in place. There are some industries that are clearly going to be high-risk businesses. Those businesses are ones where you are coming into contact with a lot of people, a susceptible population, where people are unavoidably going to have to come in contact with each other. Obviously what comes to mind is dental care, someone who's in home health, or someone running a senior care facility. I know we kind of list that there as a very high risk and high risk businesses. For our purposes, we're not really making that distinction. If you're high risk, you should probably take all these extra measures to ensure that both your employee and your customers or client are fully protected. So that's kind of the first piece, is figuring out where you fall. Medium risk businesses are ones that's, medium risk businesses are ones that, your employees, by way of example, in a lot of the food processing companies, have to stand shoulder to shoulder or right next to each other, or there's just unavoidable contact, human contact that will occur, whether it's you and the customer or employees. That's sort of a medium risk where you can control the environment, but nonetheless, there is still going to be a lot of close contact. Low risk businesses, fortunately, where the legal services, by way of example, is fortunate that, relatively speaking, we can do a lot of what we do without a lot of specific human to human contact. There are obviously some, in every business, some human contact that is around, but we're fortunate, in legal and a lot of other similar types of businesses, where you can do a lot of the work remotely and provide services without having to sit down face to face. And that's the first step at figuring out exactly what steps you should take, what measures you should put in place, is really evaluating where you fall on that spectrum of risk from the coronavirus.
Obviously, I think, Alex, the first thing what you're saying is not to tell you what you're saying, but you're really looking at taking a look at your business. How much contact are you having between your employees and your customers? What is the nature of that contact? And then how can you control that contact as much as possible?
Exactly. And so once you've evaluated that, then it's time to decide how you're going to implement your physical safeguards. Now, there's two prongs to this. You have your policies and procedures that you implement, but then on top of that, you also have some specific physical controls that you're going to want to implement. For healthcare industry and those that are in high touch, high risk businesses, you're going to want to ensure that one, you increase your cleaning regimen and make sure that the cleaning regimen that you're doing is appropriate given the risk. You know, that may require that you change what you do just all out from a cleaning perspective. You know, you also want to increase the separation of traffic patterns so that people don't come in contact with each other. You know, a lot of the people in these high risk industries will be susceptible as well. So that's also all the more reason that you have to take these extra measures. To the extent you can put up barricades, create, you know, maybe put a room between where you're seeing patients or clients, just to ensure that there's no contact whatsoever between people. And when you do have contact, it's very controlled contact. For some of you, it would be, go ahead.
So Alex, just to jump in there for a second. So let's say you are a dental office or a medical office, and you have a typical situation where you've got a waiting room. And typically you're going to have people in that waiting room. And as you open up, you know, your waiting room may be sufficient size where you can space people 6 feet apart and control that environment. But if not, what can you do? I think one of the things we're seeing is, you know, you come in and you do your normal check-in process to let them know that you're there and whatever the paperwork is that needs to be filled out. But then you're leaving a cell phone number, and then you're going out back to the parking lot and you're waiting in your car until they are ready to see you, at which time you get a text or a phone call, and then they bring you in. It's thinking through that type of methodology where you are minimizing the exposure of not only your employees to the patients, but you're also minimizing the exposure between the patients. So we're controlling that waiting room environment by literally making the waiting room everybody's individual vehicle, as the case may be. So that's an example, I think, of a practical way to control that type of environment.
And to that point, as you think through and you think that you're going to have, by way of example, to jump on that example, if you're going to have them wait in their cars and you're going to let them know when you're ready for them, you know, contemplate where the high traffic area is. You know, so if there's a specific door that everybody in and out is touching, contemplate exactly what you need to do to ensure that either that door is sanitized every time someone comes in and out, or that, you know, you are able to prop the door open. You know, you would have to take those extra measures just based upon the fact that, you know, you're going to change how traffic comes and goes from your business. So it's not just taking that first step, but it's also contemplating what that next step is, understanding what's going to be extremely high touch and likely, you know, your, I guess, you know, the point in contact with that could ultimately be the problem.
Yeah, I think a good example of that is, you know, we at our office, we physically went through the office, and any door that you needed to touch, if it could be propped open safely and, you know, securely as far as security reasons are concerned, during the day we're propping that door open so that nobody has to touch it as they're coming and going. And I think that's an important point, in that you literally have to sit down and walk through a typical interaction with a client, walk through that interaction and look at everything that is touched, every other employee that's come into contact, every other patient or customer that might come into contact, and what do you do to address that so that you are being as safe as possible. And that's just, and again, the propping of the doors is just one example where, geez, how many times do you just go through a door and you don't even realize that you're touching it? But if when you're getting ready to reopen your business and you want to be smart about it, that's the type of thing you got to walk through and then see if there's a solution to that interaction.
Absolutely. Just a couple other things I wanted to point out was the CDC is really obviously worried about personal protective equipment. I'm sure everyone sees that on the news. You know, they're asking that people only use that equipment, you know, if it's traditionally used for those services. There's going to be specific situations where, you know, especially in the high risk category, where you may need to use use it where you didn't before. Think about dentists, other places where unfortunately, the patient can't continue to operate without, or continue be there and get services without with the face mask on. So the alternative is using protective equipment. But to the extent that you don't normally use it, for the most part, the CDC and is asking people not to sort of buy that equipment right now, just based upon the shortages. Then the other key piece is, and we'll talk about this a little bit later on, but it has to be clearly discussed and made known and communicated, whether through signs or letting all your clients know ahead of time what the policies and procedures are. That just has to be communicated effectively. And obviously right now, you're taking all these measures, and sometimes something like that, effectively communicating can be challenging. So just something to keep in mind as you're instituting these physical safeguards.
I think that's a good point on the communication, Alex. For example, we're obviously in an industry where we have some client contact. And one of the things that we do in our office is a lot of estate planning and wills and trusts. And as much as we can do things electronically, there are certain things that still have to be done via paper. And one of those is signing a will or signing a trust. So to address that, that's obviously an interaction between our office people, lawyers and sports staff, and the client. So what we've done is we've literally created a step-by-step instruction, or it's more of just a protocol, I guess, of what we're going to do when somebody comes in to sign a will or a trust. And we're providing that information to them beforehand so that they know exactly what the procedure is going to be. And so it's not a surprise to anybody, and that they understand that we're doing that for their protection, for our protection, and yet we're still trying to function and get their estate planning done. But that's an example of communication that we're using specifically for that one item in our practice that we still need to have that physical contact with. So if you are in that type of industry where you need to have the physical contact, it is a good idea to have those policies and procedures, that protocol, out in front before you ever had the interaction with the client or the customer.
Absolutely. So, which actually brings us to the next aspect of this, is you got to have administrative controls, essentially your policies, protocols, procedures. It's one thing to put up the physical safeguards. It's another thing to have written policies and procedures, so it's clear what both employees and customers are supposed to do. So based upon the level of risk that you have and the physical safeguards that you put in, write those protocols down. To the extent that you need to make a sign out of it, go ahead and write, signs up and post those signs up. When you're advertising and marketing, communicating with your customer base, make sure you're taking the opportunity to relay those specific protocols. The other aspect to this is, it's one thing to be able to open, it's one thing to be able to open safe and smart. There are going to be ramifications from just human emotions, right? There's a level of fear out there. There's a level of concern. And so you're naturally going to have a lot of questions from your clients, but you should also be prepared for employee absenteeism. That's something where, nationally you're hearing a lot about this as well, where employees are just uncomfortable coming back to work, especially in those high risk environments. When you're talking about, a senior care facility, and the senior care facilities across the country are particularly susceptible and getting hit harder than most other industries. A lot of those, especially the lower paid employees, are seriously concerned for their health and are not willing to risk their health in order to go to work. So in that regard, you have to be prepared for that, which means, contemplate and talk in advance about those possibilities from a business operations perspective. And then you're also going to want to communicate with your employees about that and make sure that you have policies that address that. Now, obviously every person will need to address that in their own way, depending upon industry and likelihood of this happening. But then, ultimately, it's something that will inevitably hit most businesses at some point, where you have to deal with this, with this issue from an employee perspective. Anything else, Mike?
Yeah, I just wanted to as you're designing the protocols, I think one of the things that's going to come up, or that we're hearing a lot come up, is my employee wants to wear a mask to work, or the opposite, my employee doesn't want to wear a mask to work. Um, should we have a policy that said, and I'm not talking about, PPE equipment, but, a mask that, that you can get and that a lot of people already have. Should you require that all your employees be wearing masks, or should you be requiring that all your customers or your clients or your patients be wearing a mask? To the extent that they can. That should be clearly laid out in your protocols, and that should be clearly relayed to the employees and the clients. And if they refuse to do it, then I guess the question is, what is the next step for you, the business owner? Is that a policy that you can send? If your policy is that everybody's wearing masks when they're, for example, outside their office, in our case, if everybody's supposed to have a mask on, then, and if an employee is not doing that, can you ask them to leave? And Matt's going to address some of these issues when we talk more specifically about the employees later on. But should it be your policy that if you have a customer that is refusing to wear a mask, what do you do? But you should have that policy, and you should adhere to it, just so that you're consistent. But think through that beforehand, because it's quite possible that, if you're a home-based service where you're going into people's houses to repair something, and you want to have a policy that while your employee's in there, that employee has to always have their mask on. To the extent the employee violates that, what can you do, or what should you do? So those are things to think through when you're putting together your policy.
Exactly. And then it's not just, I know we've talked a lot about in this little section about employee-facing policies and procedures, but just want to quickly highlight, client-facing policies and procedures. It's just as important for the safety of both your employees as well as the clients that you institute policy procedures for your clients as they come in. We've talked about the physical safeguards you should take, but from a policy perspective, maybe perhaps, if you're an appointment-based business, have a larger separation of appointments, so that way you have time to do the cleaning, you have time to, ensure that you don't have an overlap of people in your waiting room. Ultimately that may slow and create some bottlenecks in terms of amount of patients and clients you can see, but unfortunately that's just kind of where we're at in terms of making those policies and procedures for the safety of everybody.
Yeah, and along those lines, I think it's important, and kind of what certainly we've been talking to clients about, is you almost have to do a walkthrough of what a typical client interaction is going to be, and really slow it down so that you're looking at every part of the experience with the client, and seeing where there is an interaction, where there is a touching of a door, where there is a touching of a piece of paper, where there's an interaction between a patient and a physician or a staff member, and literally doing a walkthrough, so to speak, and just going through what that client experience is going to look like, and then designing the policies around that walkthrough, so that you're, and it's important, because if you just open up and you say, well, we'll just make sure we socially distance, have you really thought through how many times there's an interaction between the customer and your employee? Have you thought through that? How often that happens? What it's going to take to socially distance in order to do that? And to your point, how much is that going to slow down the process of moving on to the next client or customer? So I think it's important to just physically do that walkthrough, so that you know exactly all the interactions that are going to happen, so that then you can plan to address each one of those. That'll help not only your employees feel safer, but if you communicated that to your clients and your customers, they'll feel safer coming into your establishment, which again, I think you're right. There's going to be this fear of people wanting to go out and interact with the economy. Yeah, as much as we want it to open, there is going to be this fear. And to the extent that you can make it clear that, hey, I've thought through all of these things, and your interaction with us is going to be safe. All right, let's talk a little bit about waivers, Alex, because I think this is becoming a more talked about item.
Yeah, absolutely. So there's obviously, depending upon the industry, waivers are going to be a more and or less important role in this. There's certain things that you can't waive in various industries. And so, the trick here is, if you want to implement a waiver, yes, go ahead and implement it in conjunction with the physical administrative safeguards. Having a waiver doesn't mean you should just go ahead and not take any other steps, right? It's a matter of how many layers do you want to put on to protect your business, your employees, and your clients. So go ahead and get the waivers in, but each waiver really will need to be geared to a certain extent to the industry that you're in. If you are in a very high risk business, there's certain things that you just can't ask your patients to waive. And so depending upon exactly how what services you're providing, say it's healthcare, in the healthcare area, we will have to, we would want to take a quick look at exactly what is waivable and what is not waivable, and make sure that the waiver they are signing is actually going to be effective, right? And understanding exactly how much potential liability will still be out there based upon the pandemic and everything going on.
Yeah, and I think, Alex, just to kind of reiterate what you're saying, a lot of businesses, if you're service oriented, you may already have waiver language in your either your contract or work order or whatever it is that you're doing. You may have waiver language already. This is obviously a fairly new type of injury, if you will, and it's not clear yet whether the typical waiver language is going to protect you from a COVID-19 incident. So I think it is important that you review the waiver language if you have it, and figure out whether you need to specifically address whether COVID-19 should be added to that waiver language to make sure that it's going to be covered. And then even if you have the waiver, what Alex, just to again point out, just because you have a waiver doesn't mean that everything you do is waived. So if I know for a fact that I have an employee that's tested positive for COVID, and I send them into your home to repair your refrigerator, and then you get COVID, no matter what waiver I have, that's pretty much an act of gross negligence or willful conduct that you cannot waive in most situations. So you do have to, the waiver it's not an end all and be all. It's a part of your toolkit, I guess, that you can use to help open your business in a smartest way as possible. But you do have to still continue to take the other steps and the other measures in addition to having a waiver, if that's something that makes sense for your business.
Exactly. Yep. And then the other piece that I want to discuss, because it keeps coming up, is that it's going to get harder to source certain materials. As is plainly obvious, the supply chain to a certain extent for a lot of materials is just changing. So from a business operations perspective, ensure that when you do reopen, that you're able to get the supplies you need, not just to operate the business, but for all these extra physical and administrative safeguards that you put into place. So if you need more cleaning materials, make sure that you're not going to run out midway through the first day because you're going through triple the amount. To the extent that you need to for your particular industry, go ahead and try to find multiple sources and multiple vendors. Unfortunately, it seems that a lot of suppliers are able to supply one day and not the next. It's just where we are in the global supply chain. So that's just something to work on, as you push forward towards reopening.
And I think that's a really important point, in the fact that almost every business, you have your preferred suppliers that you just like to go to, and you always go to. It's what you do. And the only time you deal with this issue is they're out of something, and then you're scrambling to find it somewhere else. I think in this situation going forward, like you said, the scramble situation is going to probably become more the norm than the exception. So think through where you can get through, or think through where you can get your supplies, other sources, and have those ready to go in case one of them fails, that you're ready to go with another one. All right. Anybody else? Let's see. I think that was it for yours, Alex.
Just one last
Oh,
little
sorry, one
thing
more.
here.
Yeah, sorry.
Yeah. Yeah, no, the other piece we've kind of discussed on it, so I won't harp on it too much, but communication with both your employees and customers, make sure that you're doing proper training so everyone understands it. And then you also have to make sure to monitor and enforce all the physical and administrative safeguards. And like everybody needs one more thing, just remember whatever you were subject before in terms of rule regulations, make sure you don't lose sight of that as well, especially in some of the heavily regulated industries, whether it's healthcare, some of the food processing businesses can be heavily regulated. So it's just something that unfortunately, while you're just getting a lot more on top of your plate to contemplate. So just don't lose sight of those original issues that you had to deal with before.
That's right. Your business was your business before. You still have to run it that way with all the rules and regulations you were subject to before. Unfortunately, this is just another layer that we're going to have to add on. All right. Thanks, Alex. Matt, Ryan, I think you guys are going to talk about calling employees back when you do decide to reopen. So Matt, why don't you go ahead?
Sure, and I just wanted to follow up to start on a couple of things that that Alex was saying there. In terms of requiring employees to monitor and monitor compliance with those administrative and physical controls, there is going to need to be probably a heightened focus on that by employers to ensure that employees are reminded about what their expectations are, and that the expectations be clear and then consistently applied and enforced. The challenge, and we've seen it directly, and in terms of advising clients, is these maybe even a daily reminder or things that come up as we all learn the new way forward. There may be risks that are not initially identified that then become identified and then need to be added to the protocol. That kind of folds back into what happened in March. So I'm just going to go into the a little bit of the history, I guess. Back in March, we were talking to clients and hearing about companies here in Omaha and elsewhere, and it was a real moving target in terms of what companies were going to do. There was a major company who was going to split their staff and go every other week in the office and every other week working remotely. That company had a positive COVID diagnosis of one of its people, and all of a sudden everybody in the place is working remotely. In that scenario, large company had a disaster recovery plan in place that was successfully executed and accomplished. That was an administrative situation, so almost exclusively white collar workers, and that lended itself to working remotely pretty easily. A lot of other employers had to make decisions about, so what personnel are essential, and kind of as the outline states, can these personnel perform their jobs remotely? Who can do that most efficiently? So at this point, when you're talking about bringing employees back, I think that all of that just basically needs to be put into reverse. If something is working and it's working effectively, then employees may just want to, maintain the status quo and not bring people back right away. And the same thing goes with personnel that need to be laid off. There's going to be a bit of a transition period to where, what is, we can go to the next slide. What is next? What is the next step to be followed? Because day one, employers are not necessarily going to need all personnel back and on deck. So if it is appropriate for someone to stay remote and they're effectively doing their job, that may be one way to manage this process of reopening. Looking at people who have been laid off, what levels of staffing are going to be required under the new business demands. What levels make sense from the perspective of the employer. There is obviously the opportunity for people to remain out of work, to remain on furlough. There is no mandate that employers bring anyone back. I know, for instance, a lot of companies that I've learned about or been talking to, they don't plan to do anything until June 1st versus May 4th. So it's a real moving target, and what is best for each employer and each set of employees is going to be a pretty factually intensive analysis, and it's going to involve management and human resources, and the types of preparation that Alex was going through is going to be critical, because you do want to have, by doing those things, by following those steps that are outlined in some guidance from OSHA or CDC, you are going to have the employer can then point to that standard as the why of what it's doing versus being perceived as simply acting randomly. The prediction at this point is that we will have future stay-at-home or social distancing orders, and no one knows what the timing of that looks like. You look at New York City; they are easing restrictions, but then the governor has talked about adjusting the dials. So some of the social distancing might be maintained, but other things are going to start to return to normal, or a new normal, and then they are monitoring. Are they going to have a spike in diagnoses? Are they going to have a spike in hospitalizations? Or no one wants, obviously, a spike in deaths. That is the type of monitoring that's being done on the big picture government scale, and it informs what employers should be doing, because it may just make sense to hang tight and to not bring people back until we see how this goes. Predictions I've heard is that we're going to be looking at stay-at-home or social distancing orders for the next 12 to 18 months, frankly, and so we're definitely in a transition time where people may or may not choose to bring people right away.
And Matt, just if I can jump in here, if you do decide to bring people back, I think it's important to keep in mind that now's, if you bring people back and say, great, we got people back, and then we can just sort of forget about everything, all the stuff we just had to go through. But I think, given what you're saying, and that we are likely to have some future either stay at home or social distancing, or as you say, they're going to adjust the dials on this thing. Now, if you are bringing people back, now is really the time to look at what you've done, whether it's working remotely or how you pared your staff down and how you figured out who's essential and who's not. It's time to look at that, see what worked and what didn't work, and really to try and fine tune what you were doing in light of the fact that you're probably going to be doing it again. Yeah,
that's exactly right. You need to look at where you are to determine if you should be taking steps now. And some of those steps that you may be considering taking right now may be reversed in a month or 4 months or 6 months, So I think that's the long range. That's the big picture that employers need to be considering. A lot of people, I know folks who they don't want to go back. They're working remotely. It's working for them. They want to go back occasionally for some of the social interaction and for some of the environmental benefits of being at the office. But overall, they want to keep doing their work at home, and it's working for them. And I think a lot of employers are gonna allow that. I think some people may want to come back full time, and some employers may say, well, no, we're good. We don't really need to have the additional overhead of providing you with an office. We'll provide you with the equipment at home. We'll maintain electronic communication platforms, and we will, monitor your effectiveness in doing the job. So it's going to cut both ways, or maybe, multiple ways, I guess I should say. And, just as we were feeling our way along back in March in terms of the moving targets that everyone was facing, that could very well happen in the weeks and months to come. If we're kind of going into some of the things that Alex had covered on the next slide, but for the critical considerations for people to bring back personnel who are working remotely, again, it's a matter of what is in the employer's best interest. There's a lot that's happening that employees certainly have rights, and they have rights to a safe workplace, and that's the general duty clause under OSHA requirements. At the same time, and employees, will have their preferences, and the way I'm talking about, whether an employee wants to stay working remotely or return to the workplace. Those things can be considered, obviously, but at the end of the day, the employers still have a right to determine what is going to happen with their workforce. With the limitations that everyone is facing, with some of the exceptions that we're going to get into. But again, looking at that CDC guidance, the OSHA guidance, trying to get external standards to apply will be in the interest of the employers, so that if a person claims that something was wrongful or discriminatory or retaliatory, whatever it might be, that they can say, well, look, here's what we were guided to do. We either did that or we went above and beyond, and we'll go into more as far as what steps an employer can take. Liability if a worker is infected with COVID-19. I think we're going to find out more about this as claims are made, as factual situations develop. But there are going to be workers' compensation claims arising out of this crisis. If someone has a reasonable belief or can connect causally that they were infected with COVID-19 while at work or because of work, because of an exposure at work, then I think it's very likely that they're going to have a workers' compensation claim. And I would expect that people are going to see that. And that is more of a strict liability scenario. I mean, obviously, employers should be taking the measures that they can to protect employees, just as they're taking measures to protect customers. But if that causation is established, it doesn't really matter how much the employer did there. If it's established that the cause was the workplace, then just as with any other workers' compensation claim, the liability is going to be there.
And Matt, I assume as with any other claim where an employee is injured at work, if it goes beyond, let's just say, for example, I've got a couple of employees that I know are COVID-19 positive. This is an extreme example, obviously, but
right.
If I know they're positive, but I need them here functioning, and another employee gets sick because they're there, gets COVID and presumably it's because they're there. Is there a claim beyond workers' comp for that?
I would say no. I would say that workers' comp would remain the exclusive remedy. That would be certainly a position I would take on behalf of our clients. I'm not saying that there wouldn't be some type of allegation that that almost intentional or reckless exposure maybe would lead to some other type of heightened liability. But there's a lot of workers' compensation cases where employers have done some things that may be perceived as pretty egregious and have caused injuries in the workplace. But nevertheless, the employees are entitled to the exclusive remedy of workers' compensation. And that's kind of the grand deal that was struck with workers' compensation statutes to begin with. And I believe Nebraska was the first state to establish workers' compensation. But the grand arrangement is, there's going to be strict liability, but there's also going to be a limitation on damages. There's not going to be compensatory damages or punitive damages. So I think those exclusive remedy concepts would still apply.
Yeah, so I'm imagining that everybody that's on this call and listening is going to do what they can to protect their employees in as safe an environment as possible, with the cleaning and the social distancing and everything like that. But I think it's important that they're reassured that, hey, even if you do that and one of your employees still does contract COVID-19, that the remedies are what the remedies would be under any other workers' comp type of situation. Even if it gets a little more extreme, or gee, maybe you think somebody has it, but you still let them stay there, it's still going to be sort of the same liability you would normally face.
Yeah, and that's absolutely right. And some of the things that we talked about, when this all was starting was, what's old is new again. The ADA guidance from the first SARS outbreak was very useful to people, because it outlined how to, whether, you could take temperature, do testing, and so there's going to be, like I said, extreme, like you're saying, extreme situations, egregious situations, and we're going to see that. And so the system will be tested. But I think overall, the standard and traditional methods of dealing with workers' compensation injuries should still apply. I want to turn it over to Ryan. Maybe, Ryan, you can take a minute and talk about, if someone is going to continue to work remotely, what additional measures might be needed for them to do that.
Of course. Thanks, Matt. So really, there's just a lot of different considerations that need to be taken. And as Alex alluded to earlier, and Mike and Matt have all alluded to, it's just a lot of readdressing policy issues that you may have in place, looking back at how you're communicating with your employees. Matt really touched upon the essential employees. And as you're calling employees back, identifying who these essential employees are, and on a practical standpoint, what their roles are versus maybe roles for employees that you don't deem essential. And essential doesn't necessarily mean that that it is essential, like they're not a revenue producer, or essential means it's just, you need these employees to keep the business running. If you have staff that handle a large volume of calls or mail intake or the billing, and that's been stopped now, or maybe they were doing it remotely, you bring those people in, and then you need to readdress, are there areas, if you have employees coming back into your office, that only maybe certain employees can go into? Is there a mail room? Is there a room with all the copiers? Because if you want to minimize, as Alex talked about earlier, if you want to minimize what objects and surfaces people are physically touching, are you going to have policies in place so that only select people can go into these rooms or parts of the building? Only select people are going to be the ones that are opening these doors, and how you move forward from that.
Yeah.
And so there's a lot of different considerations in defining what is an essential worker and the different steps to take in place. Are you going to continue to prohibit face-to-face interactions and meetings, so that when employees are coming to work, are they expected to be in their office and continue to still perform like they are working remotely, even if they are physically in the office? And it's what can you do to minimize the risk and exposure while still functioning in the office? And as Matt had alluded to in a few previous slides, it's going to come down to how your business defines and then continues to redefine. I feel that we've said a lot of how in previous webinars we defined what remote working is. Now we're defining what returning to work is, but still having those policies in place. Maybe it didn't work out the best, your remote work policy and now readdressing who's going to be working remote, who should be working remote. And these are just very practical steps you can take so that if, as Matt said, if this continues, you can identify other concerns and who will be working remotely, what physical objects are being taken from the office. And these are just, we have we have checklists that we provide on our website too that can help you walk through and answer these questions.
Yeah, and it is a process, and moving to the next slide, and this is something that's already been discussed. It's communication with the employees. If people are refusing to return to work, or if they prefer working remotely, I think employers at this time may be able to be a little more flexible. But in terms of performance measures, effectively performing the job, there may have been some missteps over the last several weeks for some employees, and those employees, now may need to be brought back to what their original expectations were in terms of performing their job. The refusal issue is going to come to bear, and these are some of the communication things. I just want to direct the audience to the slide. ADA does not go away. So you may have two levels of people who don't want to come back. One is that they feel a vulnerability that does not arise to the level of a disability, or they may have a disability that may require a reasonable accommodation in the form of working remotely. Those are pretty fact-intensive process under the interactive process required by the ADA, and I think employers are going to face more of that. I want to move through the next couple slides pretty quickly. The next slide has a list of. Go ahead, Jim.
Can I interrupt you just quick? The state departments of labor, Nebraska and Iowa yesterday said if you're called back and you refuse to report, then you're going to lose your eligibility for unemployment. And then the governor kind of softened that by saying, well, if you have a health concern, try to work it out. Does that have to be treated as an ADA request? If someone says, I don't want to come back, does all employers have to treat that pretty much as an ADA process?
I would say that there are principles that employers can use from the ADA process. That the interactive process is statutorily and regulatorily mandated. It happens to work pretty well in a lot of cases, and so employers may want to use that as a framework for communication. Does the employee have a doctor's note? Does the employee have an underlying health condition? Without getting into the specifics of what an employee may be claiming as a limitation on their ability to work, say they do have say they're immunosuppressed, but it doesn't arise to the level of a disability. I think that back and forth, that general communication is going to be critical. And then, is there a particular heightened risk at the workplace that needs to be considered? So to me, I think if you have someone with that underlying health condition and there's heightened risks at the workplace, that's going to get you into a situation where you're more likely to allow an employee to refuse to return versus if those factors are not present. So you're on the right side. So there are exceptions. There's specific exceptions that allow an employee not to return. They're somewhat limited. They're limited for the most part, except there is that last loop. You might call it a loophole, but the last catch-all where the employee has to quit the job as a direct result of COVID-19. That is going to require some justification from the employee that they have good reason to quit. Under Nebraska law, if an employee has good reason to quit, then they are still going to be entitled to unemployment compensation. But again, that is going to be a fact by fact, case by case, factual analysis. If we go to the last slide, I'll just cover the unemployment, or my last slide. And Jim, you kind of previewed this. Right now, this extra payment of $600 a week, I think it as some would say, it presents a moral hazard for the employees because they may be choosing to stay out of work, or they may attempt to choose to stay out of work and try to maintain those enhanced benefits. The problem there is if an employer offers an employee their job back and there is work available to that employee, the employee is lawfully required to disclose that when the employee is continuing to certify the need for benefits. Their failure to do that is going to open them up to accusations of fraud by the state or by the employer, and that is a serious matter. And there may be ramifications, including repayment of benefits, civil penalties, or other remedies that the state may pursue. As a general matter, if an employee doesn't fit into some of those specific exceptions and they don't have good cause to not return, they should be considered to have voluntarily quit. And in that scenario, they will generally not be able to qualify for unemployment benefits going forward. So I think employers need to communicate pretty clearly, and then employees need to be aware of what some of the possible consequences might be. I can turn it back over to you guys, or if you have any questions, I'd be happy to address.
Well, Jim, I don't want to dip into your time because we're running out here quickly, but I did want to just, Matt, if I want my employees to wear masks, can I require them to do so?
I believe so. I think that is it's a work condition that can be established. The more justification you have for that based on external guidelines, the better, obviously, instead of it appearing to be random. But I think that is a reasonable requirement that could be imposed. The flip side of that is, can an employee insist on wearing a mask? That gets more back into that OSHA general duty clause. Is there an imminent risk of death or serious harm in the workplace that justifies an employee in unilaterally insisting on protective equipment that may not be justified? And again, that's going to get to your specific factual analysis.
All right, thanks, Matt, and thanks, Ryan. Jim, we want to get into now that you've gotten your PPP loan, what the heck do I do?
Yeah, and this is I think I saw a survey that said something like 80% of small businesses had applied for the PPP program, and obviously $600 billion has been earmarked, and that might not even be enough. So, this is a big deal, a lot of money at stake. Obviously, the ability to get the maximum forgiveness can be really important to allowing this to change from a loan basically to a grant. So, and I think the first thing on the list is to keep these funds earmarked so that you can make it clear if there is any kind of audit or follow-up exactly how you used them. And the second point, I think, Mike, is one that we wanted to touch base on because it's been getting publicity yesterday, and that's the question of the necessity certification. And this has been getting press because some of the larger entities have applied. The Los Angeles Lakers of the NBA got a $4.6 million loan, and it's caused some political feedback, as you might guess.
And I think we talked, Jim, about the question is how it all revolves around what is necessary. So is it necessary that I've exhausted every other possible avenue of obtaining funds in order for my business to survive, and that's why I got a PPP loan?
Yeah, I think it's pretty clear that that's not, you're not required to say this was your only possible lifeline, because Congress, specifically in the CARES Act, which authorized the PPP program, waived what's typically a requirement in a small business administration loan, which is that you have to demonstrate that you don't have access to the regular business credit market. And that's specifically waived. What they did require the borrower is to say that the economic uncertainty created by the COVID pandemic makes the loan necessary to support the ongoing operations of the business. Now that's a pretty broad standard, and the certification itself just says that you have submitted accurate information and you haven't made any knowingly false statements. So most businesses are probably, should be fairly comfortable that what they submitted would meet those tests. They did provide a response to the frequently asked questions, the Treasury Department, and they really were focused, and a lot of the media attention's been focused on, publicly traded companies, companies that are portfolio businesses in a private equity structure or something like that, and clearly had other sources of liquidity other than going through this program. And I think that's where the focus has been. But then, basically Secretary Mnuchin yesterday said any loan that's more than $2 million, they will provide some extra scrutiny, some auditing process to the forgiveness process. So what that's going to mean, it's not totally clear yet. I think almost everyone that actually submitted in good faith is probably going to be okay on the certification in terms of criminal penalties or those types of things. The question is whether there will be a standard for forgiveness adopted by rule in the same way that the 75% rule that we'll talk about in a minute, that might limit forgiveness if there's a lack of showing of this necessity test. And we don't know how that's going to play out yet. We do know everyone should reassess because the Treasury said in their guidance, reassess this. And if you repay by May 7th, we won't, there'll be an amnesty basically that they won't pursue any action against anyone who repays a loan by May 7th. So if there's any issue with that at all, the borrowers should be, thinking that through and trying to meet that May 7th test if that's an issue.
All right, thanks, Jim. Let's go ahead and walk us through the rest of the slide here.
Yeah, I mean, basically, I think if those who are borrowers under the PPP program are aware probably by now the 75% rule, that's what's really important is that the defined term payroll costs have to be at least 75% of the amount that's going to be forgiven. So, and there are some limits on that. It only applies to the actual compensation, salary, and wages, the health insurance costs and the retirement costs, also some sick leave and vacation time, etc. But some of the other benefits like education benefits or health savings accounts, those don't count as defined term payroll costs. And then there's a limit on the salary and wages per individual of $100,000 per year, and that's obviously prorated to the 8-week period. But that is capped, so you don't get to count more than that for any one person. With the other 25% or less, depending on how you want to use it, then you can use it for mortgage interest, rent, and utility costs, and all of those are defined in the rule. They have to be in effect prior to February 15th in order to be an allowable use. There's one allowable use, interest on non-mortgage debt. It's not forgivable, but it's permitted. And then anything else is not allowed. So if you don't have enough allowable costs to meet the amount that you borrowed, set that amount aside and just repay that. You don't want to get into the complications of using it on things that are not allowed uses. So
do keep it segregated, and obviously tracking is going to be important, because what's going to happen down the road here, Jim, is you're going to have to file something that says here's what you use it on, right?
Yeah, and that should be on the next couple slides here. Basically, in terms of planning, you want to strategize based on what's the best use for you. Now, some businesses may have more expenses for rent, utilities, et cetera, that they want to pay. And again, some of the payroll issues based on what Alex and Matt and Ryan have been talking about, you might not be able to bring everybody back during this 8-week period. So you can strategize, and we have tools that we've been working on here to help people maximize the amount so that they do still get the 75% rule and can use the most possible on their other expenses if that's what's best for them. The FTE count, if you want to apply that, you should be reinstating people to your FTE count by this week, because the more you get closer to during the 8-week period, you can get penalized if your FTEs are lower. I mean, not penalized, but less forgiveness anyway, if your FTE count goes down compared to what it was during the base period, which is earlier this year or last year at a similar time of year.
So if they're going to be bringing people back, Jim, it's important to do it as soon as possible during the 8-week period for purposes of the maximum forgiveness, because you're going to compare the FTEs during this period to the FTEs in a prior period, and you want those to be essentially equivalent if you want to get the most forgiveness.
Right, there's going to be a ratio of FTEs to FTEs. Now, they don't have to be the same people. They don't have to be the same positions. You could have one person who's not come back, and you could hire 2 part-time people, temporary people, to fill that spot, and they still count as FTEs. So the FTE to FTE comparison is not based on actual people or positions. The reduction on compensation, that does look at specific employees, and you don't want to reduce compensation for people making under $100,000 a year by more than 25%, or that will affect your forgiveness as well. And again, you want to just keep track of everything and make sure you're not double dipping, getting credits for under other programs, that you're also seeking the same forgiveness under the PPP. Yeah, and the next slide is showing what they're going to require. The application at the end of the 8-week period is going to go to the lender, and the lender actually will make that determination as to the forgiveness amount. They're going to require documentation of what your FTEs were during the covered period, the 8 weeks after you get the loan, and that you can't change that 8-week period. They provided some guidance on that too. You get the loan when you get it, and that starts your 8-week period, and that's what your 8-week period is. So they need you to show your pay rates, your pay periods, your payroll tax filings, all those things on the list there. And then when you submit that, someone from your business will need to certify again that that is an accurate documentation of what you spent the money on and what your employment situation was during that 8-week period.
So record keeping during this 8-week period with these things in mind will just help you down the road when you're getting ready to do that, the application for the forgiveness.
Right, and again, the deadline for actually submitting the application hasn't been determined yet. It's just we don't know if they're going to set a deadline or not, but the lender itself will have 60 days on the next slide there to give you a response. And we don't know whether they're going to be an appeal process or what happens if, in fact, the lender says you're not entitled to what you expect you're going to be entitled to. We do know that anything that's not forgiven becomes the loan. There'll be a 6-month deferral period on that loan, and then it will be payable over 2 years with a 1% interest rate. And so that'll be, again, that balance between what becomes loan and what becomes grant, and that'll be determined by this calculation. And again, for those purposes, bringing people back sooner at a higher at their basically what they've been compensated for in the past, it's going to maximize your forgiveness. You're going to have to weigh that against the concerns, obviously, that were talked about earlier in the hour about what's best for the business in terms of safety and security and all those other issues. So the tax issues that can arise, we did want to touch on that a little bit. The cancellation of indebtedness, typically, if you're familiar with tax accounting, is going to count as income. If you have a debt for $10,000 and the person you owe it to cancels that debt, it would count as income. But there's a specific provision in the CARES Act that says when this PPP loan is forgiven, that debt is canceled and it is not a taxable event. So that'll just become a grant, a tax-free grant, which is good for everybody. But it does raise some questions about how you treat the business expenses that you've funded with these loan proceeds. Are those going to be deductible? And we don't have guidance on that yet, but there's some provisions in the tax code that certainly have made some raise question about whether that would be disallowed. We don't have guidance on that yet, but that's something that businesses need to be made aware of in their tax planning. And then obviously, again, there's rules throughout the CARES Act on double dipping. The employee retention tax credit cannot be used if you're funding those employee spots with PPP forgiveness funds. And the same thing with the Families First Act that provided a bunch of credits for paid leave, sick leave, and emergency leave. If you're getting tax credits for those positions, again, you can't double dip on that and get a forgiveness on the PPP for those same positions. So.
Yeah, so it's nice. I mean, it's great that the forgiveness is not included in income, which, absent that provision, it otherwise would have been included in income for a business that has debt forgiven. So that's great. To take it to the next step, that we get to, not only do we get it free or it's not income, but now we get to deduct it because these are business expenses that we're using it for. That on first blush would appear like, gosh, you're double dipping there. It's not income, but you get to take it as an expense. But haven't gotten any clear guidance on that yet. And when we do, we'll be getting stuff out and following up on that. But right now, that's sort of an unknown. Seems a little too good to be true, but you never know.
Yeah.
All right. I would like to thank all of our panelists for all of their thoughts and insights today, and thank everybody who tuned in to listen to us. And we appreciate your attention, and we'll be having additional things coming out, more webinars as additional things are changing with COVID, as it seems to be almost daily. But thank you all for your attendance.